Hello and welcome back. We will continue our lecture on syphilis, and actually, in this part of the lecture, we will discuss investigations. So, we will first discuss what investigations we can perform for the mother and then for the baby. So, for the mother, actually, there are two types of tests. The first group is called treponemal tests, and the second one are called non-treponemal tests. So if you remember, when all for all pregnant women in first trimester, the booking blood test, they include testing for syphilis, which is either VDRL or which is the venereal disease research laboratory test, which is the blood test, or the rapid plasma reagent test, which is the RPR test. These two both belong to non-treponemal tests. They are used as screening tests. Okay. So, and then to confirm if if these, we use one of them. So if either of these is positive, then we have to do confirmatory tests, which is the treponemal test. Okay, there are few included in this one, which I'll discuss in the coming slides. So the main difference is in the treponemal test, as the name suggests, treponemes are used as the antigen, whereas in non-treponemal test, cardiolipin or lipoidal antigens are used. Okay, that's the difference. And why non-treponemal tests are less reliable? Because they can give false positive results. For example, in many conditions like HIV, systemic lupus erythematosus, or other autoimmune disease, and strange enough, even in pregnancy. So it's strange, right? So pregnancy, but the risk is very small, okay, of having a false positive result. So that's why even in pregnancy, we know that in pregnant women, it can give a false positive result, but the risk is really small. So still we use it as part of the booking blood tests. Now, the triple element antibody tests, they are different types. We will discuss in coming slides, and they confirm a past or present infection. The main problem with these is it is difficult to differentiate whether it is a past infection or the patient is currently has syphilis. Okay. Um, okay, so it's so then why do we use non-treponemal antibody tests like rapid plasma reagent or venereal disease research laboratory? The main reason is, of course, we use it as a screening test, but also the main benefit is it monitors the response to treatment because the titers, the levels, they change. Okay, with active infection. So, for example, if the previous levels were low and now they have increased, that means most likely it's an active infection, current infection. Now, these are the tests for the mother, which we will discuss in more detail in coming slides. And for the baby, what we can do, if we are able to detect, to take a blood sample, and how do we do that? Of course, we involve always the fetal medicine unit, right? And then if they can perform a chordosynthesis, which is risky, okay, of course, there is risk of having even miscarriage. So if we can get blood sample from the baby, then syphilis specific IgM antibodies can be performed. Okay, but since it's risky, so more commonly, how the baby can be investigated by amniocentesis rather than chordosynthesis, right? So, and what will be done? What test will be performed? It's PCR of the amniotic fluid for identification of the treponemal DNA. And sometimes, if even if, say, for example, in many hospitals there is no fetal medicine unit, or if the insurance does not cover, or some other reason, right? If the patient declines, for example, amniocentesis, then sometimes ultrasound features are suggestive. For example, fetal hydrops, hepatomegaly, dilatation of bowel loops, etc. And like we have discussed all of them before, some of the features which can happen. So, how to confirm what is the best test to detect current infection? So, it's a syphilis nucleic acid amplification test, or PCR of a lesion or a spinal fluid is the most definitive test for confirming current infection, especially in early syphilis or neurosyphilis. And neurosyphilis is the tertiary, okay, as it directly detects the bacteria. So, detection of bacteria, that's the best, that's the ideal situation. But say, for example, if there is no lesion, then of course we cannot do this test. Now, what are the different types of syphilis tests which we can perform? So first one is Treponema pallidum particle agglutination test, TPPA, or Treponema pallidum heme agglutination test, TPHA, or syphilis enzyme immunoassay, or fluorescent treponemal antibody absorption test. Okay, so all of them What do? They detect antibodies to what antigen? The treponemal itself. So all of them are treponemal test. Okay, and they are confirmatory test. But as I said, the main problem is they do not tell us whether the infection is current or past. Okay, all of them. That's the same for it applies to all of them. So a positive fluorescent treponemal antibodies absorption test result indicates a past or present treponema pallidum infection. So it is true for all of them, okay, and will typically remain positive for life even after successful treatment. Okay, so even if a person has been previously successfully treated with syphilis, these tests are going to be positive. Okay, so follow up with a rapid plasma reagent or VDRL is necessary as its titer levels can track the response to treatment or indicate a new infection. So that's why these rapid plasma reagent test and venereal disease research laboratory tests are important, because if the titers go back low, that means they're responding, the person is responding to treatment. Okay, so the titer monitoring of titers, that's why these. So WHO says So WHO says that WHO STI guideline recommends benzathine penicillin G 2.4 million units once intramuscularly. Okay, when benzathine or procaine penicillin cannot be used due to penicillin allergy, then WHO says that either use doxycycline at least for 14 days or ceftriaxone, which is the cephalosporin 1 gram intramuscular injection. Remember, we use the same for pelvic inflammatory disease, right? But it's for 10 to 14 days, or in special circumstances, is erythromycin 2 gram once daily. Okay, so in PID, it's this ceftriaxone is only once, not daily for 14 days. Okay, so that's it for this lecture. If you have any